Next up, Jan Fosset, Vice President of Klick Health.
Hi, everyone. I'm going to talk to you a bit about the relationship of voice with hardware. Voice is a digital technology. Like every other technology, you have a piece of hardware. And hardware in general in the electronic world is all about not being sufficiently good. Every time you buy a piece of hardware, you want the next one because it's better. And the people who make this hardware, be it TV or telephones or computers or fax machine, are constantly making a new one to sell it to you. We've seen this morning with Apple, for example, but the business model goes across the whole board of electronic. What we do with this electronic stuff doesn't really matter. If you buy a TV from LG, they don't care if you actually unpack it and look at it. When you buy a computer, the transaction's done. The only time where it makes sense or there's some interest in what you do with your piece of hardware is when you upgrade it. We've all seen the dreaded, there's an update for my computer or there's an update for my phone, and it never makes it better. It just makes it so damn slow that I want to buy a new one. So this is very interesting because that goes across the board of all digital technology except voice. Voice is very different. The hardware that supports voice is a speaker, a microphone, and a really basic piece of electronic to digitize that. This has been mastered decades ago. We don't really need to make a better one. There's no need to buy a new Alexa every year. The one we have works. You don't even need the hardware. You have a phone. It has a speaker. It has a microphone. You have a laptop. We have this everywhere. So the hardware is very different. The business model is not about selling you hardware. It's about what you do with it. So we've entered post-scarcity hardware where the cost is irrelevant, where the hardware is irrelevant. All the business, all the transaction, the important stuff happens with what you do with the hardware as opposed to buying the hardware. So I work in a lab where we do a bunch of experiments with technology, and we wanted to see how much can we do with a piece of hardware that doesn't really cost much. Like, is there a barrier? Does it limit us to get the most rudimentary piece of hardware? So I built one. You see here the video. This is last week. I built a kit from Google, building basically a speaker. It took about 30 minutes, including setting up the lighting and pausing to take pictures. And it's quite impressive what you can do in 30 minutes with something that cost $4.99. So we built a smart speaker. It's right here on a ledge, right here. And we're going to show you what it does. Now, why is this important? In digital medicine, usually we have to install a piece of hardware somewhere, at the bedside, in a home. Somewhere there's going to be a piece of hardware, and then at some point there's going to be someone saying, we can pay for this. We don't have the budget. Who's going to support it? You know, it becomes a roadblock. In this case, if the hardware costs as much as a pencil or a notebook, like paper notebook, it doesn't really become a barrier anymore. You can start a pilot project where if somebody is concerned about the cost of hardware, you say, I'll supply it. That's okay, don't worry about it. We've heard today, we've heard this morning, all the immense amount of possibilities there is to do voice in healthcare, whether it's in the operating room, at the bedside, at home, and so on. All of these can be facilitated if you use super cheap hardware and you focus about the technology behind all that's happening in the cloud, all the intelligence, and basically abstract the hardware as if it was not an issue anymore. This is going to change the way we do a lot of things. We're going to show you a demo of that prototype we built. My colleague Alf is here because he doesn't have an accent, and it works much better with, those things.
Let's see how this goes. Ask Symptomate about my headache.
Okay, let's get Symptomate.
Hi, I'm an automatic symptom checker. This service is for informational purposes and is not a
UX people note, real doctors don't ask for terms and conditions.
Call your local emergency number immediately. Have you read our terms of service and accept them?
Yes.
Thank you. What concerns you most about your health? Please describe your symptoms.
I have a headache.
Okay, I'm noting headache. What else would you like to report?
That's it.
So we have a bunch of those kits for you to build if you feel so inclined. We have 90 of them, so the first 90 people who go back after this session to where the food was this morning, or at lunch, there's 90 of those boxes, pick them up, and just have fun building them at home. It will show you that you can do everything you can with a high-end speaker with a really, really low-end system. Thank you very much, and we stayed on time.